guys, my name is Ganesha. So today I am going to speak about coronavirus and I'm going to share you some facts about coronavirus like symptoms, causes, prevention tips, and should we wear a mask. So let's go right into it. So COVID-19. In early 2020, a new virus began generating in the headlines all over the world. Its origins have been traced to the food markets in China in December 2019. From there, it reached the countries such as United States and the Philippines. The virus officially named SARS-CoV-2 that has been responsible for millions of infections globally, causing hundreds and thousands of deaths. The United States are the most affected country. The disease caused by the infection with the SARS-CoV-2 is called COVID-19, which stands for the Coronavirus Disease 2019. So now I'm going to speak about the symptoms of coronavirus. So, doctors are learning new things about this every day. So far, we know that the COVID-19 may not initially cause any symptoms for some people. You may carry the virus for 2 days or 2 weeks before you notice the symptoms. Some common symptoms that have been specifically linked to COVID-19 include breath, having a cough that gets more severe over time, a low-grade fever. These symptoms may become more severe in some people. Call emergency medical services if you or someone you care have any of the following symptoms: trouble in breathing, blue lips or face, confusion, headache, chills, and body aches. What causes coronavirus? Coronavirus are zoonotic. This means that they first develop in animals before developing in humans. For the virus to pass from an animal to a human, a person has to come into close contact with the animal that carries the infection. Once the virus develops in the people, COVID-19 can be transmitted from person to person through respiratory droplets. This is the technical name for the wet stuff that moves through the air when you cough or sneeze. So, the viral material hangs out in these droplets and can be breathed into respiratory tracts where the virus can then lead to an infection. The 2019 virus hasn't been definitely linked to a specific animal. Researchers believe that the virus can be transferred from bats to another animal, say the snakes, and then transmitted to humans. So, these transmissions likely occurred in the food market in China. And lots of question comes, who's at increased risk? So, you are at high risk for contracting COVID-19 if you come in contact with someone who's carrying it, especially if you have been exposed to their saliva or been near to them when coughed or sneezed. Without taking proper preventive measures, you are also at high risk. Live with someone who's contracted with the virus, are providing home care for someone who has contracted with the virus, have an intimate partner who has contracted with the virus. Hand washing is key, and sanitize it. And disinfecting the surfaces frequently can help decrease your risk from catching these and other viruses. And the older people and the people with certain health conditions have a higher risk for severe complications if they have contact with the virus. These health conditions are lung conditions and asthma, and certain heart problems and immune system conditions and severe obesity. And then other conditions such as the kidney disease or the liver disease. How are coronavirus diagnosed? COVID-19 can be diagnosed similarly in other conditions caused by the viral infections using a blood, saliva or a tissue sample. However, most tests use a cotton swab to retrieve a sample from the inside of your nostrils. The CDC, some states' health department and some other companies conduct tests. On April 21, the Food and the Drug Administration (FDA) trusted the source approved the use of first COVID-19 home testing kit. Use the cotton swab provided people will be able to collect the nasal sample and mail it to the designated laboratory for testing. The emergency use authorization specifies that the test kit is authorized for the use of people whose healthcare professionals have identified as having suspected COVID-19. So, a lot of question comes. What is the treatments available for coronavirus? So, there is no treatment specifically approved for the COVID-19 and no cure for an infection. So, although treatments and vaccines are currently under study, instead treatment focuses on managing symptoms as the virus runs its course. And seek medical help if you think you have COVID-19. Your doctor will recommend treatment for any symptoms or complication that develops and let you know if you need to seek emergency treatment. What are the possible complications from COVID-19? This most serious complication of COVID-19 is type of pneumonia that has been called the 2019 novel coronavirus infected pneumonia, the NCIP. So far the NCIP is the only complication specifically linked to the 2019 coronavirus. Researchers have been seeing the following complications in people who have been developed COVID-19. Acute respiratory distress syndrome, irregular heart rate, fatigue, heart damage or heart attack. So, how can we prevent coronavirus? Okay, so the best way to prevent the transmission of an infection is to avoid or limit the contact with the people who are showing the symptoms of COVID-19 or any respiratory infections. The next thing you can do is that good hygiene and physical distancing to prevent bacteria and viruses from being transmitted. I'm going to say you guys some prevention tips you can follow. So, wash your hands frequently for at least 20 seconds at a time with warm water and soap. So, how long is 20 seconds? About as it takes to sing your ABCs. Do not touch your face or nose or mouth when your hands are dirty. Do not go out if you are feeling sick or have any cold or flu symptoms. Stay at least 2 meters away from people. Cover your mouth with a tissue or inside of your elbow whenever you want to sneeze or cough. Throw away the tissue papers you use right away. Clean your objects you touch a lot. Use disinfectants on objects like phones, computers, utensils, dishware and doorknobs. So now I'm going to show you guys a video about the prevention methods of COVID-19.
Yep. Nope. 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 Yep.
So, as you guys saw in my video, the prevention tips, please follow those things. And then the lots of question come. Should we wear masks? Should we wear masks? Should we wear masks? So, if you are not out in a public setting that is difficult to follow physical distancing guidelines, it is recommended for you to wear a cloth face mask that covers your nose and your mouth. When worn correctly and large percent of the public, these masks can help to slow the spread of COVID-19. Okay, that's because they can block the respiratory droplets of the people who can may be asymptomatic or people who have the virus but have gone undiagnosed. Respiratory droplets can get into the air when you exhale, talk, cough, sneeze. What's the outlook about COVID 19? First and foremost, do not panic. You do not need to be quarantined unless you suspect you have contracted the virus or transmitted and confirmed to the test results. Following simple hand washing and physical distancing guidelines are the best ways to help protect yourself from being exposed to the virus. The COVID 19 probably seems scary when you read the news about the new deaths, quarantines, and the travel bans. So, stay calm and follow your doctor instructions if you are diagnosed with the COVID 19 so you can recover and help preventing it from spreading. Do not believe in the rumors and verify the facts of the government organization. Stay home, stay safe, and please subscribe to my channel to get new videos, and see you in the next vlog.